Welcome to the BruDog video series, designed to raise awareness about canine brucellosis. This still relatively under-recognized disease requires the commitment of all stakeholders: dog owners, official and private veterinarians, breeders, retailers, kennel owners and operators. Together, through simple yet effective actions, we can protect the health of our pets and safeguard our communities. Canine brucellosis, caused by BruCell is a zoonotic infectious disease that affects the reproductive system of dogs. The clinical manifestations mainly include infertility, abortion, and, in some cases, discospondylitis and uveitis. When such non-specific symptoms are present, anamnesis plays a crucial role. Particular attention should be given to the animal's origin, especially if it was imported or passed through a kennel, and to the presence of reproductive issues, such as abortion or infertility. Transmission of canine brucellosis primarily occurs through contact with infected material, such as the placenta, fetal tissue, and lochia. Contact with seminal fluid, and to a lesser extent urine, may also serve as sources of infection, particularly in environments where multiple animals share the housing. Diagnosis requires laboratory tests conducted by official labs, including serological, bacteriological, and molecular tests, which, when appropriately combined, provide satisfactory levels of sensitivity and specificity. It is essential to take a thorough anamnesis, with particular focus on determining whether the dog comes from foreign farms or has an unknown origin, was adopted from a kennel, has infertility problems, or has experienced miscarriages. If a suspicion arises from these factors, it is advisable to avoid cohabitation with other dogs to minimize the potential risk of transmission, establish an appropriate diagnostic and, if necessary, therapeutic protocol. In the course of health surveillance of dogs managed by public and private facilities, it is recommended to test new dogs entering kennels and new breeders in breeding facilities, conduct annual checks on breeding farms and kennels, with particular attention to potential cases of abortion and infertility. If brucellosis positivity is confirmed, it is advisable to isolate infected animals to limit the risk of contagion, implement an appropriate diagnostic and therapeutic protocol, as bacterial sterilization by brucellosis is not always permanent and relapses are common, recovery may not occur in all cases, and the dog may remain a carrier. For these reasons, it is recommended to perform periodic serological and bacteriological monitoring to determine whether the infection persists, proceed with sterilization, or, if it is not possible, prevent mating, provide the owner with all necessary recommendations for the proper management of the infected animal, including appropriate cleaning and disinfection practices, offer the facility manager guidance on the correct management of infected animals, including biosecurity, quarantine, and isolation measures. Regularly assess the welfare status of infected animals, particularly in cases of chronic disease. For more information, check the website of your national competent authority and ask your vet.